This unit deals with diagnosis and treatment planning. It's in reality the culmination of all of these previous units which you have been reviewing. It's now to the point where you're going to take the information that you've gotten in your clinical examination, in your history, in your radiographic surveys, and your study models, and putting them all together so that you have a complete idea of what the patient's problems are from the standpoint of their general health, from the standpoint of any medications they may be taking, from the standpoint of their specific dental problems, and in view of all of these factors, how they can best be managed from the standpoint of a projection of treatment. Now, before we can treat anybody, we have to know what they have as far as dental conditions are concerned. So we start out, as we have in the series, with the patient interview, the health questionnaire, the recording of the findings that are pertinent and relative to any problems which they have, which in the treatment and dental management may be of concern to us. You have reviewed the unit on radiographic interpretation and know by this point what you should look for, the type of findings that are important, that which are of diagnostic quality, those areas which should be thoroughly investigated and recorded. In the previous units, you've also concerned yourself with the interpretation of the study casts, where there's a great deal of information which can be gleaned from them if you carefully and meticulously review them in all their aspects and have an appreciation that they are one diagnostic aid which can give you a great deal of insight as to the problems the patient has experienced in the past, and are of inestimable value when it comes to the point of projecting a diagnosis. This is particularly true when we're dealing in fields of fixed or removable prosthesis, when we're concerned with occlusal disharmonies, which are of a extensive nature. We want you to put all of this together in one package, for this is the way you approach comprehensive diagnosis, and from the impressions you've received from all of these diagnostic aids, you come up with a comprehensive diagnosis of the patient's problem. It is only then that you're in a position to evaluate and project the type of treatment that will be required to restore this patient to a good state of dental health, dental oral health, and also to maintain it and prevent the recurrence of the problem that precipitated this situation initially. I think if we're going to be successful practitioners, one of the first things we've got to consider and appreciate is the fact that we must recognize and identify as best we can the causative factors that produce the conditions which we see when we work up diagnostically a patient. We've got to establish this firmly and clearly. It has to be recorded in all of its detail. We've got to then try as best we can to determine each factor which we can control and manage as best we can to eliminate the causative agents. Secondly, we've got to go into the correction of these defects that resulted, be they of a carious nature, a traumatic nature, be they periodontal in nature. In this area, second area, we're doing the restoration of function, in other words. And then lastly, we've got to prevent the recurrence of the disease process. Let's go back to number one. When this patient first comes in, when you receive the application for this patient, and you have completed the essential forms, which we'll review in just a minute, one of the first things you want to do before you do an examination is to review the medical health questionnaire. Now, this you have gone into rather thoroughly in the first of these sessions and learned how to record and how to interpret the affirmative findings which may occur, where these act as a guide for you in the projection of the treatment. Secondly, you have taken a series of dental radiographs and you have learned to review them methodically for all of the salient areas of diagnostic importance in the periapical series as well as in the bite wing portions. You have further taken study models and are now in a position to view these from the diagnostic standpoint, for they afford you an opportunity to appraise occlusion, alignment, wear facets, malpositioning, general architecture of the gingival support tissues and the like, placements of frenums, all factors which will enter into your considerations of a more comprehensive approach in diagnosis. Remember, these are permanent models, and to be valid, they must be noted either by inscription, actually scribing these casts, or by the use of an indelible pencil, the patient's name and the date the impressions were made. When you have all of these diagnostic aids together now, we're ready to start our review and entry, where you now have a better than fair idea of what the patient's problems are. Let's go over this chart now and see what we can come up with relative to your approach in the records management and how this leads you into a simple, organized effort towards diagnosis and treatment planning. Not starting with the first page, but starting with the application for treatment. Let's remember that this must be completed and signed by the patient, and if the patient is under 21 years old, a parent or legal guardian must sign this. The patient should be allowed adequate time and explanation, if need be, of the statements of release and conditions relative to application for treatment at the University of Texas Dental Branch. A second page, which you're going to be required to have completed, is a release form. Read it and understand it yourself so that in the event the patient has inquiries relative to it, you'll be able to discuss it with them. These two forms must be signed before any chart can be made out. The third form, which we've already mentioned, is a health questionnaire. I feel that this should be completed also before any chart is made. When these three pages, the application, the health questionnaire, and the release form have been completed, when your advisor reviews these three with you, with the patient seated in the chair, you're in a position then to have the chart made and assigned to you and initiate your examination and the entries. Now let's go to the first page. On page 1, the information relative to the patient's name, occupation, home address, and so forth, that will be filled in, typed in by the clerks at the information desk on the first floor. Your name will appear here. The major group of treatment is an indication on this line of what the predominant area of dental concern is so far as it is reported on the screening examination. Now, this information appears on the top right corner of the application when you pick it up in the diagnosis area. This type of treatment will either be comprehensive, limited, or an emergency type. In this instance, your patients will be a comprehensive type assignment, and the chart will be assigned to you by date and initial by your instructor. His name appears on this line as case sponsor. The authorization to begin the diagnostic portion of your workup is entered here under examinations to be made. The date and the exam number, which is indicated by the column on the left of the page for each type of examination. These exams are entered here by number. Any special instructions are noted by your advisor and initials it. Upon the completion of these, they're checked off on the right column. And that pretty well takes care of page 1. We don't enter prophylaxis here. Prophylaxis is a form of treatment. We do enter all types of examinations, x-rays, the request for study casts, and so forth. The second page deals with the preliminary subjective examination. And it starts out at the top with the line chief complaint, and this should be written in the patient's own words. Under it, the history of complaint. How long has the patient had the problem, and specifically what type of signs and symptoms are there present? So far as mouth history is concerned, these are check areas. You fill these in following your interview with the patient. This entire area, along with the right side, which is page 3, noted at the top with the title of Mouth Examination Record, these are a reflection of several areas, your health questionnaire as well as your clinical examination. Any special findings which require an entry or should be included appear in this area under case notes related to the above findings. This may include allergies. This may include specific medical problems which are related to the patient's past history. And it is in this area that it is advisable to enter at your first appointment a record of the patient's blood pressure, pulse, and temperature. This gives you a baseline to operate from. In the event in future treatment this patient becomes ill or has an untoward reaction to any medications, local anesthesias, or treatment that you may be performing, this recorded baseline of physical functions or physiological status is the basis on which you interpret change. When it's completed, date it and sign it with your name. On the other side of the page, all of these areas, mouth and adjacent structures, edentulous areas, periapical areas, and so forth, periodontal, mouth hygiene, functional relationships, these entries can be made at the time of the initial clinical examination. If the findings are normal, a check mark goes in the block adjacent to the appropriate entry. If abnormalities are present in any area noted, this is entered in ink on the right side under descriptions of abnormal findings. Part of this has to be done in conjunction with your radiographs. Part of the information you will gain from the refractory casts or study models. Part of it you're going to get from a meticulous clinical examination. When this is completed, you're ready to start a definitive diagnostic examination to record all abnormalities and all findings on page 4. The code for entry of specific conditions you'll find in the left column. The numbers on the left side, such as you see here, C1 caries enamel only, C2 moderate dentin involvement, etc. When these are applicable, enter this code number in the box opposite the tooth itself. So far as the general periodontal status is concerned, an entry should be made here if a periodontitis or a gingivitis or a periodontosis or any condition of the gingiva other than normal is present. The recording of the periodontal examination is initially done here, indicating, as you have been instructed in that portion of your training relative to perio exams, entering 6 entries per tooth as to periodontal pocket depth where present. Here again, any specific case notes relative to your findings here will be added at the bottom of the page, the area provided. This examination sheet is to record your clinical findings and also to record the radiographic findings. For example, proximal caries, which may not be present in a clinical exam and may be found in a radiographic screening examination, should also be entered. The presence of all restorations are entered in black. Dental caries are entered in red. This completes a projection of your actual findings relative to lesions of the teeth and the supporting structures. At this point, upon completion of this examination sheet, marked at the top, Diagnosis, page 4, you're now ready to go to the treatment outline. And it is in this area where you reflect the selection of treatment and schematically draw in on the appropriate tooth surface the type of treatment, when it is of a restorative nature, that you're going to be doing. Each area relative to clinical departments are going to see this patient and make a notation that they have seen it, that they have approved your projected treatment, and will probably help you modify your selection initially, their date, and when the work in that area is completed, we'll sign it off. When all departments who will be concerned with this patient have reviewed your treatment outline and noted it as correct, in this area, your advisor, faculty advisor, will review the case with you, will note the fact that it is a fully developed treatment outline, and comment in the appropriate square whether it is a good, fair, or poor prognosis with treatment, dated and initially. When this is completed, a duplicate copy is filed with the clinical coordinator. And now you're ready to go to work. As the patient comes in on the various appointments, enter on the back side of this page, the treatment outline page, by date, the appointment and what was accomplished. If the appointment is broken by the patient, if the appointment is canceled by the patient, or if due to problems on your part, such as illness, the patient has to be rescheduled, note this. This serves as a recording of continuity of patient contact and treatment. It also gives a basis where patients repeatedly break appointments for their being discontinued as a treatment case. Now, occasionally, due to various reasons, patients do not keep their appointments, and in so doing deprive you of valuable clinical experience time which cannot be made up, for there's no areas within the schedule for make-up time in clinic. When patients repeatedly break appointments, there is the capability of discontinuing any patient who fails to show up regularly for scheduled appointments. If you have it documented on the back of the treatment outline sheet, this information to your advisor gives him basis to terminate and discontinue this case. And at this time, he will make a note in this portion of the chart, if continued, give reason as to why this case was dropped. It may be dropped because the patient moves out of town. The patient has an illness which is going to prevent their coming in any reasonable amount of time. For whatever reason, he will make a notation, and this chart will then be taken off of your list, returned to the file, and any subsequent student who picks this chart up, considering this case as a potential teaching patient case, will see perhaps that this patient had a long record of broken appointments and won't be trapped into accepting the same type of patient again. This is basically the type of entries that you'll be making. You're not expected to know how to do every bit of it right off the bat. You're going to have an opportunity for guidance and help in your clinical experience. There are going to be questions and confusion, as always, whenever any new, relatively complex type of record system is introduced. I feel, however, at this time, you've got a pretty good working knowledge of what is expected of you, and I hope the necessity of keeping complete and accurate records, reflecting in all instances the diagnosis completely projected, and then the treatment plan to show a planned approach towards the management of the patient's dental-oral disease.